Dear students, we will be discussing in this module about the various aspects related to elder care. We need to know that there is a fast changing in social cultural context in which the family as an institution, which is playing an important role, started changing in its terms of its functions and types. In this regard, we have to focus our attention on what specific model of care that can be highly suitable in addressing the needs of the elderly in our society. Another aspect that requires major attention is because aging is much faster than existing in the society, and in view of the extended lifespan as measured through life expectancy, we need to know that the population aging is very fast in certain societies, and thereby the programs and schemes have to gear up. In this context also, we have to see how best the care of the elderly can be addressed. The other specific dimension in which we need to know in the context of India's elderly is, given the heterogeneity among older population who are residing in different parts of the country, given their high socioeconomic differences that exist in their background characteristics as reflected through heterogeneity, we need to have a clear understanding about what type of care which will be suitable for the elderly in each of these specific setting in which they are residing. Another dimension which we need to understand when we talk about elderly care is that feminization of aging, which is occurring in our society. More and more female elderly are coming to 60 plus age group, and in view of that, they being highly vulnerable in our society, their issues become very specific, and thereby we need to know how the care of the elderly is addressed, especially when the female elderly are there in a majority of the population. The other aspect is multiple vulnerabilities. As we have seen in the earlier modules, that by attaining 60 plus itself, elderly experience one form of vulnerability, but if their socioeconomic conditions are not conducive for them, given the 60 plus age group which they attained, furthermore with multiple vulnerabilities in terms of poor socioeconomic conditions, the low level of housing conditions in which they are experiencing, the way in which their family profiles are changing, and also the lack of independency in terms of the financial security, in terms of their health accessibility issues, all these also will make them to be having a multiple vulnerability among them. In this regard, we need to know that there is a specific need of the elderly which needs to be addressed. So, given these multiple vulnerabilities, we need to channelize our efforts in working out and evolving a suitable model of care that can address the maximum population of elderly in our society. The other dimension is about long-term care needs. In the sense, when elderly are living in a higher age brackets, further and further problems are going to multiply and their dependency is going to increase. Given this, there is a need to evolve a long-term care solutions for them. In that regard, we need to see how best such model of care can address when the elderly are living longer and also attaining higher and higher age groups. The other aspect is that as age advances, the dependency on health and social care also increases. So, this also dimension which requires our attention, how best when the health issues are compounding and also they are increasing in among the elderly population, the type of social care that is required also should be taken into consideration when we are working out for a suitable care model for the elderly population. In this regard, there needs a special attention of understanding how best we can segmentize the older population in terms of rural-urban differences, in terms of their educational status, in terms of their gender backgrounds, in terms of the socioeconomic class groups to which they represent. All these segmentation is very important because in each section the elderly people, given their profile, their issues related to the aspects for their care also differs widely. Given this background of the elderly people, we need to emphasize on the response of the community, how best such care can be provided by the community. In this regard, we have to emphasize how the response of the community in terms of the needs and the community setting and the way in which a larger picture in terms of the services and also the way in which we can place our elderly for getting a maximum benefit of the existing community based issues and also programs that can be benefiting for their improvement of their conditions. Other aspect is we need to profile the potential caregivers so that they also have to play the important role about how best they can network and also respond to the various programs and schemes which are meant for them and also located in their own community. Furthermore, we also to respond what should be the elements that should be seen while screening potential candidates for involving them in each of these things. In this context, when we are talking about a community cadre for services for the elderly, we need to see that there should be a separate geriatric care background elderly also should benefit. For that, we have to work out with respect to the special needs of the elderly so that the caregivers can look into with respect to the segmentization that occurred among the elderly population. In view of this, we need to evolve the type of caregivers in our society so that they can focus their attention in addressing the needs of the elderly. In that context, we have to be very careful about choosing the type of caregivers, especially when we want to see for their socioeconomic backgrounds and also their proficiency and their own commitment in the field of geriatrics and gerontological aspects as part of their activities. In the same way, we also should know that they should work very closely with the existing public health system like district hospitals, community healthcare centers, primary health care centers and sub-centers, so that these caregivers will have a continuation of the assistance from the public health system, so that as and when they require additional assistance, they can always get from the existing public health system. At the same time, we also should see how best we can create such models of care at later stage. They can be replicated at a macro level so that their scalability and the replicability can also be important for additionally interesting to other caregivers in other geographical areas. Also very important that we have to maintain that emphasis on the quality of these programs in implementation through the caregivers. So these are some of the important aspects that we need. Furthermore, we need to integrate with the government programs like National Institute of Social Defense, which caters to the needs of the elderly through various programs. For instance, there are some training programs, there are some certificate programs, diploma programs, and also there are various other aspects in which National Institute of Social Defense is involved in addressing the elderly issues. Similar is the case with regard to Rehabilitation Council of India, so that their component of interventions can benefit these people. Corporates is another important thing. Through their corporate social responsibility can act as an important intervention. As we all know that it is a mandatory for most of the corporates to spend part of their profit through CSR in their communities of their operations. Among the major trust areas that have been provided by the Government of India in which their money can be spent towards the various community developmental programs, aging is also has figured in a major way. In that sense, the caregivers, we can, once they form, it can also be coined, and also they can have a collaborative effort with the CSR teams of the local corporates, so that they can strengthen the caregiving role and they can reach out to a larger part of the elderly population. Furthermore, public-private partnership models also can be worked out, where there can be a collaboration between government and NGOs and other corporates, so that they all can evolve how best they can come together and work out with innovative programs and schemes, so that the elderly population in their areas can benefit highly. Furthermore, in this regard, we have to see how best we can create demand, so that by improving the visibility of the cadre of caregivers for elderly, the demand for their presence will make a lot of difference, so that these programs can be sustainable. Other dimension in this regard is to involve senior citizens clubs. As we know very well that senior citizens associations play a significant role in creating awareness, in bringing together several elderly groups to the mainstream, and also there are several efforts of addressing the needs of the elderly through senior citizens clubs. And in this regard, it is very important that the senior citizens representatives can also work out in creating a cadre of caregivers in our society, so that the elderly's quality of life issues, their needs can be addressed at different platforms, and also the suitable programs and schemes, once they are evolved, to see how best they are implemented at ground level, these senior citizens clubs can form a major change agent in creating such awareness, and also to act as a change agent for the elderly people. Other important aspect is that when we build up a cadre of caregivers, they can act as a facilitators by identifying and connecting the potential clients, especially among the elderly populations, to the NGOs and also private agencies that exist in their area. Further important thing is about follow-up of care that requires, when the formal caregivers play an important role, it may be difficult for them to continue, whereas this cadre of caregivers can act as a follow-up to these existing care services. The other aspect is to facilitate the non-governmental organizations to undertake various activities related to preventive care, given their reach, and strengthen the curative care of private agencies. That is another dimension which can act in this regard. Also, the caregivers can also act as disseminators of new information to both non-governmental organizations and private agencies, so that the elderly issues can be rightly addressed. These are some of the things which we need to address when we are talking about caregivers for elderly population. In the area of caregiving, we should know about how the long-term care realities exist in countries like India. In this regard, we should know that most of the countries, especially located in Asia, are the fast aging region in the world, where the number, proportion and growth of elderly are increasingly seen and also highly visible. It's a near universal that in these societies, the family plays an intrinsic role in long-term care for the elderly. However, long-term care has increasingly been examined with relation to institutionalization. The other dimension is there is an increasing migration of youth. Given the rural-urban migration that is taking place due to high industrialization and urbanization, which are increasingly coming up, the important aspect is that the migration of youth is affecting care of elderly, due to the elderly are left out in the place of origin, and the youth move to the urban areas for their livelihood and other issues. The other aspect is that in Asian context, it is very important that the heterogeneity is a major landmark in area of aging. For instance, heterogeneity like class, gender, socioeconomic status, geographical aspects, health conditions, all have shown that there is a huge variation among elderly population with respect to these things, which in turn has contributing for their multiple vulnerabilities that these elderly people are experiencing. Furthermore, when we are talking about feminization of aging, female elderly experience the double burden of caregiving among this population. For that, they have to be very clearly laid down for their promotion of quality of life, how best the government can evolve suitable policies and schemes. What about the response of key stakeholders in caregiving and elderly care? Let's segmentize in terms of the response of key stakeholders like government, private sector, community-based organizations, NGOs, self-help groups, like that. Let's start with the government. If we analyze the situation, there is a dismal GDP proportion allocation for elderly care. It is highly insignificant, so there is a need to improve upon this situation by allocating additional resources. Similarly, the programmatic response also is highly inadequate. So, these are some of the important aspects which have a tremendous influence on elderly care. Furthermore, poor intersectoral coordination. For instance, there are several ministries, several departments which are also catering to the needs of the elderly population, but there is a coordination which is inadequate, and that's why we need to emphasize on intersectoral coordination. In the case of private sector, we need to know that they are mostly unregulated, fragmented. Mainly they are located in urban, that's why they are urban oriented. Similarly, the issues of high cost about their services. Furthermore, in some of these private sector, issues related to quality of services is also important for us to understand. What about the response of the community-based organizations like NGOs, CBOs, SHGs? Presence is very less when we talk about this section of services. Need support from government and private sector. Then their poor networking among them, focusing on very basic services, resource constraints, then participation of elderly poor is not visible in most of these involvement of these programs. What about the gaps analysis shows in the key areas of long-term care? It can be presented in terms of the response towards policies, programs, services, in the area of financing, the systems development, and human resources. These gaps, if we understand in the areas of policies and programs, it clearly shows that there is a lack of adequate political will which leads to changes in the priorities in the national agenda. For that sake, we need to emphasize that political will is one of the important aspects in the care of elderly in our society. There are instances where we have seen that wherever political will is there are effective programs and schemes implemented, a larger elderly population have participated and benefited, so as to say that their quality of life has tremendously increased and also achieved in our society. Similarly, the long-term care policies and services, they are being developed, but they are all in a piecemeal manner, which is in response to immediate political or financial constraints. That is why the sustainability of these programs is not a major thing which has been achieved. That is why the policies and services have to be worked out on a regular basis, and there should be a continuity in allocation and to see that it reaches to the wider group of elderly in our society. The other aspect is there exists a wide gap between policy formulation and program implementation. Another dimension in when we analyze the gaps in policies and programs for elderly care is wide gap that exists between policy formulation and program implementation. No doubt the policy is a good document and it has been emphasized thoroughly what are the priorities and what are the suitable policies and schemes that have to be evolved on a regular basis so as to address the quality of life of the elderly population. But when it is implemented at the ground level, there is a huge gap that exists between the policy formulation and program implementation. And furthermore, when it is combined with allocation of resources and appropriate implementation strategies, these gaps are widened. In view of this, we need to fill these gaps by evolving suitable programs and schemes so that once they are effectively implemented, it will definitely improve the reach out for the elderly population and so that their quality of life can be addressed. In this regard, we have to see that how best we can reduce the gap between demand and supply of long-term care services. For example, there is a huge demand in terms of old age pension schemes, in terms of health schemes, in terms of social programs, but when we come to the supply of side, there is it is at a very low level. In that regard, the demand might increases and the supply comes down, and that way the gap is still larger. And furthermore, given the high population growth, especially among the 60 plus, this gap is going to widen. So the major challenge for the program implementers is how best we can reduce the gap between demand and supply. Other challenge when we talk about caregivers and the increasing number of them is how best the access to formal caregivers are there in the areas of capacity building to them, and also to see that their motivation is sustainable. In that regard, we have to emphasize that caregivers, their services have to be accepted, their services have to be encouraged, and they have to be compensated in terms of their salaries and also the other provisions for them, which will help them to improve upon their services, and also regular training to them, and also to see that their work will be recognized both by the care receivers, by their young members of the families, and by the community at large. Furthermore, long-term care for elderly is not just an individual or family issue, but one that must also be addressed by the multiple stakeholders like communities, private sector, non-governmental organizations, and the government, so that it will not be seen only informally within the family setup. The other issue is that given the caregiving and caregivers' role is very important and furthermore increasingly seen, what is the way forward in this regard? Given the population aging which is increasingly coming up, we need to understand that there is a need for recognizing elderly as a separate group who requires specific needs that requires to be addressed and evolve, design and suitable programs for them, and allocation of various resources and the implementation of schemes exactly targeting the specific elderly and based on their profile is a need of the hour. Furthermore, we need to strengthen the political will and allocate adequate resources for their care. This is another important thing which we need. Similarly, suitable policies should be developed to build sustainable systems that integrate social and healthcare services and community participation. Unless we evolve, it will not be as sustainable, because it should not be seen only as an social issue, only as a health issue, or only as a aging issues. But we have to see that it is also a part of the community issues, so that integration is very much required. Another aspect is how to promote positive aging, especially through active participation of elderly and their groups, because the elderly mostly feel that they are here mainly as receivers of care. But however, to have a sustainable programs for them to increase their participation, it is very important to promote positive aging in our society. Another important thing is, given the heterogeneity among the elderly population with respect to social class groups, with respect to their gender, with respect to their low economic status, models of care should be different and also should suit for each segment of elderly population. That's why one unifying model of care will not be suitable for all the elderly in our society. There should be various models of care for each segment of elderly population based on the profile of each of these segments of population. The other aspect is how best we can understand the good practices that exist in the similar other contexts. For instance, if in rural areas there is one particular community-based organization which is working and also is acting in a very significant way and promoting, we have to take into consideration. Similarly, we have to strengthen the governance issues in terms of its structures, process and involvement of elderly and community as decision makers and as implementers is very important. In this regard, we have to understand what are our key strategies to address them. One is data generation, the other is advocacy at various levels. Next is capacity building for caregivers. Furthermore, promoting value education and strengthening intergenerational bonds. Given the resource constraints, addressing the most of a needy elderly is important. Furthermore, we need to develop long-term care policies and programs which integrate internationally recognized strategies such as aging in place and active and healthy aging, which build on life course perspectives. Students, at the end, I would like to summarize that the caregivers have a very important role in elderly care issues. Furthermore, we have to work out how best we can see that more and more cadre of caregivers have to be, and also to see their quality of care can be promoted and rightly addressed.